Again, Patrick has mentioned, put any questions you have in the chat or wait till the end. So our next presenter is Brandi Williams, and Brandi did her APE with the Hill County Health Department. Her site mentor was Kim Berg, who is the director there at the health department in Hill County, and I will say one of our alumni. And the name of Brandi's presentation is Creation and Development of the Hill County Naloxone Distribution Program. Go ahead, Brandi.
Hi, everybody. So as Lee said, my applied practicum experience was the creation and development of the Hill County Naloxone Distribution Program. And for a little bit of context, naloxone is an opioid antagonist medication meant to prevent deaths from opioid overdose. So my site location was at the Hill County Health Department in Havre, Montana. Havre is the county seat of Hill County, and it is the home of the Hill County Health Department. The population of Hill County is approximately 16,000 people, and the health department only served Hill County, and within Hill County, there was also the Rocky Boy Reservation. So beginning this APE capstone, there was a timeline of events that I had to follow to kind of figure out what was going on. So first, identify the issue. Second, learn the scope of how big this issue is. 3, establish credibility within the community. And then 4, develop materials. And finally, 5, put it into practice. So to start, I needed to identify the issue. In the 2020 Community Health Needs Assessment for Hill County, 88.75% of survey respondents identified illegal drug use as a problem in Hill County. 70%-ish identified it as a big problem, 18%-ish identified it as a problem. Within Montana, approximately 1 in 10 Montanans are dependent on or abusing alcohol and/or drugs. And drug overdose and death rates are higher in rural areas than they are in urban areas. Second, I needed to learn the scope of the issue. This required me to get very intimate with the legislation surrounding naloxone access and opioid overdose legislation. So first is House Bill 131, which is the Help Save Lives from Overdose Act, passed through Montana legislation. Second is the Good Samaritan Law. Every state has a version of this, and I had to get very familiar with Montana's. I worked with the Department of Public Health and Human Services naloxone staff, as they were who administered the naloxone distribution contracts. And then also Best Practice Medicine, which is an organization out of Bozeman who trains individuals to become master trainers and trained to carry naloxone. To establish credibility, I worked with a lot of different community stakeholders. This involved me speaking with the legal system, involving judges, treatment courts, the county attorney, to understand how legal issues come into play when it comes to naloxone access, Good Samaritan laws, and presence of paraphernalia on scene if somebody calls for help with naloxone or an opioid overdose. I worked with the Montana Department of Justice as well. Within healthcare, I had conversations with nurses and physicians and licensed addiction counselors to better understand how this impacts health at a community level and an individual level. With emergency services, I had a lot of discussions with rural emergency services employees. And then with it being rural communities, many of them were volunteer EMT/fire departments, and then domestic violence advocates as well. And finally, this involved working with law enforcement, including city police, the county sheriff's department, and again, the Montana Department of Justice. So then I had to develop some materials. On the left here is a flyer that I developed that is just posted at the health department. We at the Hill County Health Department kept a storage of naloxone for anybody to access at any time. There's no questions asked, there's no ID required. You just have to briefly explain to somebody to call for help if if an overdose happens, the instructions are on the box, and then you give it to them and send them on their way. On the right is a community flyer, basically saying if you need Narcan, or if you know somebody that needs Narcan, this is where you can get it. These are some other materials I made. On the left are my 2 deliverables. The top one is the guide for implementation. This is from beginning to end, how you run a Narcan program within the Hill County Health Department. Below is the Naloxone administration training. This is a presentation that I gave to community members that I trained on how to carry naloxone. So it wasn't just a skills check to make sure that they knew how to spray it. It was educating them on harm reduction and what role public health has within opioid overdose. And on the right, I developed a policy within the Hill County Health Department. This was part of the agreed memorandum of understanding with DPHHS. And it was a requirement that we built a policy. And so that is the first page on the right. And finally, we have to put it into practice. So here is my kind of rough training counts. Over the course of approximately 6 months, I trained 153 community members in Hill County. And as you can see, this is a huge variety of people. This is my health department staff. This is HRDC, which has domestic violence advocates, weatherization staff, housing, Section 8 staff, Chinook, emergency medical services. There are community members who have somebody that is a drug user in their family, and so they wanted to be familiar on naloxone. There was casino workers, home health workers, Salvation Army, teachers, treatment court, restaurant staff, bar staff, a few different schools, library employees, and search and rescue, Cub Scout leaders. I mean, the variety of people that I was able to work with was phenomenal. And it was really important to me to expose these different groups on how opioid overdose influences their community at large. So within the APE expectations, part of it was volunteer work. I was the vice president on a 501c3 board of directors for a nonprofit thrift store in our area that donated back to the community. And then I also participated in a community cleanup on a walking trail. On the right, it shows my foundational competencies and my concentration specific. Both are satisfied by the Naloxone program guide and the Naloxone community training presentation. These are my references for the data on substance abuse in Montana, and then also the community health needs assessment. And to wrap it up, I would just really love to say thank you so much to my site supervisor and boss, Kim Berg. And thank you, Lee, also for all of your mentorship for my panics and nervous moments throughout the semester. It was a really, working on this project was really meaningful to me, and it was really enjoyable to influence my community at this level. So thank you, everybody.
Thanks, Brandi. Nice job.